great question. If it were to come back on the table with Boone University, I'd be in favor of it or not? I have to admit, I would not be in favor of it right now. I'd have to be shown that. Again, because I am a private practitioner, I'm an entrepreneur, the idea of having less competition and having no choice, really, in your healthcare, as far as for one system, that would be a detriment to me. But that's coming to you as somebody who owns their own practice and is taking that risk. At the end of the day, it may have to be that way. So I can't say that I'm totally against it at all. I would tell you that if it was the opposite and Boone was talking about buying a university, I would have a problem with it. So it's not that, it's more of the idea of having choices and having competition to help keep costs down, quality improving, all the things that happen in today's society. But in the end of the day, that may be what has to happen.
Thank you, Mark. So, you know, the process is that the hospital is operating in a certain condition, certain performance level right now. It's worth X amount to any potential partner that we have. So St. Luke's looks at Boone Hospital and says, here's what it's worth to us and here's what we're willing to give to the community for it. The same with every partner. So the trustees have to look at where they are and look at their mission, which is to care for the healthcare needs of the people and the communities we serve, and figure out which option best allows us to meet that mission, which means which option best allows us to offer the highest quality of care, the most access, in the most efficient manner. That's our mission. So you can't really say right now, you know, today or in the future, without knowing exactly where your hospital is and what each of those options have to offer. The trustees need to be looking at how do we fulfill that mission, regardless of who it is. They need to pick that route. And I think that's the other concern here is the healthcare in all of our community as a whole. In 2016, there were over 15,000 people that left Boone County, or not left, I'm sorry, mid-Missouri, our 25 county area, to get care elsewhere. People come to me all the time and say, how come KU Medical Center is advertising more in Boone County than Boone Hospital is? It's because we have lost a lot of specialties and a lot of specialty services. We've had employees of Veterans United that we go and visit at KU Medical Center because they get care there that used to be provided here. So when you're looking at healthcare from the total perspective, are there certain areas where maybe we can partner or collaborate, like bone marrow transplant units where you have the volume, you work together to have a program here as opposed to having to go to Kansas City and St. Louis and your families go with them? So it's a long answer, and I know it may seem evasive, but it's the process that you use to evaluate, and then if that's the best one, then we go for it.
Thank you. Shameen.